Dr. Cherise Rohr-Allegrini is an epidemiologist and a CEO of the San Antonio AIDS Foundation. She was a pandemic flu coordinator with San Antonio Metro Health District and a communicable disease manager for the DSHS, Region 8 leading the response to H1N1 pandemic. She earned a BA in political science from UC Santa Barbara, MPH Epidemiology from Yale University, and PhD in tropical diseases from the University of Notre Dame. She is a graduate of the Latina Leadership Institute.
All right. Thank you. Thank you for that. Gosh, I'm glad we had a little break. I needed a lot of tissues. We'll switch gears a little bit. I don't think I'm going to make you cry. Hopefully, I'm going to make you want to explore the world a little bit. All right. We can go ahead. So it's 1992, and you've come of age at the height of the HIV pandemic. A diagnosis of HIV is a death sentence. You've studied politics, sociology, biology, and you want to save the world, so you go to public health school to be an epidemiologist. Your professors, though, are the folks who discovered Lassa fever, West Nile, and Ebola. And so you decide, I'm going to go traipse through tropical jungles to look for disease vectors. Off to Costa Rica, I went to look for sandflies that transmitted a virus that infected cows. But wait, I want to do humans. That's okay. It's a tropical jungle in Costa Rica. I can't complain. So in an area with more cows than people and very few women, I started my career searching for sandflies. We'd spend the day putting out these traps to catch the flies, or we'd suck them up from trees where they rested in the daytime. And then I'd bring them back to the lab and look at them. I'd have to identify them by their genitalia. And then eventually we'd figure out which were the ones that were carrying the virus. I was bitten so many times by mosquitoes in the forest and my eyes swelled shut, but it's worth it because of scenes like this. One of the perks of studying tropical diseases is tropical beaches. On the weekends, I can relax in places like this. I wanted to save the world, but I really wanted to explore the world. So tip to you all, if you can't afford to do it, you make it your job so someone else pays you to travel. So off to Kenya I went to study African sleeping sickness that infects hundreds of thousands of people in sub-Saharan Africa. My lab mates came from multiple tribes, and I didn't really understand the tribal dynamics, but they shared their traditions with me. One day, a scientist from Ghana roasted a goat served with tomato sauce. It was basically cabrito con salsa. I said it was like having a pachanga back home. So African sleeping sickness affects both humans and cows, and it's transmitted by tsetse flies. Unlike mosquitoes, where you have 1,000 eggs at a time, a tsetse only lays one larvae, which should make it much easier to control. But really, the only thing that made a difference in controlling this disease was heavy investment from the government. We're finally doing better. And again, the perks of tropical diseases. You live in Kenya for 5 months, you got to go on safari. So we packed a Jeep, put in some tents, and made a work trip out of it. This one was looking for ticks and elephants and lions and cheetah and warthog and all the other fun things we got to do while working. And then I graduated. So for a kid from a working class family from East LA, this was huge. My parents had only dreamed of college for themselves, so they loved watching me graduate and made a trip each time. I worked on mosquitoes that transmit malaria for my PhD, so I decided I wanted to complete the loop and work on malaria parasites. And I found my way to Southeast Asia in the town of Mesat. It's on the Thai-Burma border with an incredible mix of people, the Burmese government in exile, the Karen National Union, many ethnic Indians and Chinese, and a lot of expat do-gooders. You start off wanting to save the world, and eventually you learn that the world saves you. The Shoklo Malaria Research Unit had a clinic in Mela refugee camp. It was a no man's land. If you were living there, you couldn't travel beyond a certain zone. You had no papers. Our team saw patients in this clinic, and I'd collect blood from malaria patients and bring it back to the lab to study. We also had rotating village clinics in many villages. Malaria hits hardest in pregnant women and small children. So once a week, we go to villages like Waliki to do health checks, ultrasounds, malaria screens, and more. This one had a concrete center where we could go to do our clinic. Most of them don't have that. The village of Makatai is a little different. It's on the Moy River, which forms the border between Thailand and Burma. One day after being in the village, one of our nurses said her legs were sore. And when I asked why, she said it was because she had to keep crouching down to avoid the shells being lobbed from across the river by the Burmese army. Part of being an epidemiologist requires understanding the environment in which people live, and that includes ducking from bombs. So back in Texas, Metro Health hired me to develop plans against bioweapons, but then Katrina hit. I knew nothing about hurricane response, but was thrown in as the medical incident commander for the shelters as people poured in with wounds from standing in water for days. And then they asked, oh, what about pandemic flu? Who's our expert? And my boss said, Cherise. And I wasn't, but suddenly I had to learn everything there was to know about pandemics and contingency planning. So I spent the next 2 years becoming San Antonio's expert in respiratory virus pandemics and planning. I didn't know it was going to be relevant as it is now. I moved to the regional health department to oversee all communicable diseases. And in 2009, we had the first cases of a novel flu strain were found in our region. And that later became known as the H1N1 flu pandemic. That seems pretty mild compared to what we're dealing with now. I also managed tuberculosis, STIs, and HIV programs. And one of our counties was experiencing a huge syphilis outbreak related to a sex for drug rings. The most important part of controlling an outbreak is building trust in the community. So getting drug dealers, pimps, and prostitutes to trust us required that we treat everyone with respect and without judgment, and we were able to stop that outbreak. From there, I decided to tackle the politics of public health and move to a nonprofit where we worked with the state legislature to understand the science behind vaccines and public health policy. This was incredibly important because we're fighting against the tide of anti-science. And in 2019, our advocates included a group of middle school students from Bottom Academy who are now pretty well versed with how to advocate at the Capitol. They talked to legislators, they gave them the scientific reasons that they needed to pass certain bills. They got a great experience out of it as well. And then Halloween 2019, I was thinking about outbreaks of vaccine preventable diseases when I decided to dress up as the plague doctor. I had no premonition of what was to come. But by February, I was diving back into pandemics, identifying ways to address COVID in San Antonio and help to explain it to the population. And about 6 weeks ago, I returned to the world of HIV when they brought me on as the CEO for the San Antonio AIDS Foundation. The other day, my husband said that being an epi was like being a space engineer for a spacecraft. You don't have to be an expert in everything, but you have to know enough about how each of the parts work so you can fit it all together and make it go to space. I feel safe saying that now as the CEO of a public health organization like the San Antonio AIDS Foundation, it's like being a systems engineer as well. Thanks.
Okay. You brought it up a notch, starting with the bugs.
I love bugs. I love bugs.
The bugs. Girl, which I bet you was probably the only, like, answer this honestly, and we won't judge you. It's just me and you here right now. And probably people on YouTube and maybe some folks on Twitter. But was you excited when they said the murder hornets was coming?
Well, I kind of thought about it, but the murder hornets don't suck blood, and I only like the bugs that suck blood. So
I was not expecting. But literally, like, this is your season. I mean, everything can happen right now. What do you feel? Like, are you optimistic about it?
You know, as an epidemiologist that's been studying these things for years, part of it's really exciting. It's like a firefighter, a fire breaks out, and it's exciting to fight the fire. But of course, you never want the fire to break out because it's better if you never have to do it. You just want to prevent it from happening. So that really is our goal. I'm happier when I'm wrong. I'm happier when I find out everything I predicted didn't happen. When I dressed as the plague doctor, oh my God, I was not expecting there to be a plague coming up.
Right. Well, we're happy that you were able to share that with us. It's everything that we're tuned into. You gave us kind of like a behind the scenes look of it all, and we are so grateful for you. It's good to see you again, girl.
Good to see you too. Thanks.
Enjoy your evening.